Hi everyone, this video is going to go over Chapter 6, Bone Tissue and the Skeletal System. To start off, let's talk about the function of bone, or the role that it plays with inside of our human body. So the first thing you're thinking, and probably the most obvious, is support and protection. Obviously, our bones help support us, keep us erect, and helps cradle all the soft organs inside of our body. But the other thing is that it protects that. We think about our skull bone protecting our brain, and of course, our rib cage protecting our heart and our lungs. So all of our vital organs protected by the bone. The other thing is that you probably thought of is movement. So our muscles are going to originate and insert onto different areas of the bone, and that's going to allow for actual movement of our body. One thing you probably haven't thought of is mineral storage and growth factor storage. So inside of our bone, if we look at the cross section of bone, there's going to be reservoirs in there. And inside these reservoirs is where we're going to keep different things, including minerals. So things like calcium and phosphorus are going to be stored within inside of our bones. Now, another function that our bones have is that they are responsible for hematopoiesis. Hematopoiesis is going to be the formation of blood, and that is happening in the red bone marrow cavities. Speaking of marrow, we not only have red bone marrow cavities, but we also have yellow bone marrow. And this yellow bone marrow cavity is going to be where we have triglyceride storage. And triglyceride storage is important because fat is a vital resource for us when it comes to energy. So we store extra triglycerides or fat inside of this yellow bone marrow inside of our bones. Now, the last function of our bones that you might not have known about is going to be hormone production. So something called osteocalcin, a type of hormone, is secreted by the bones, and it's going to help us regulate a few important things. Things like insulin and glucose, other hormones that we produce that are going to help regulate metabolism. So as you can see, our bones play a pretty vital role in a lot of different areas outside of just support and movement and protection. So bones, pretty important for us. When it comes to bones, we have 206 of them that we have named individually. So you will be memorizing those coming up this week and next week as we work our way through the bones. We are going to divide that up further into the axial and the appendicular skeleton. So when we look at the differences between the axial and the appendicular skeleton, the axial skeleton is going to form the long axis of the body. That's going to include the skull, the vertebral column, which is going to go all the way down to the sacrum, but it's also going to include the rib cage. So all of that makes the axial skeleton. The appendicular skeleton are going to be the bones of the upper and the lower limbs, including their girdles. And the girdles are simply going to be their attachment points. And so we look at things like the clavicle and the scapula that connect with the humerus, and then of course the radius and ulna, the carpal bones of the wrist, and the rest of the phalanges. So all of that is going to be part of the upper limb. And when we look at the lower limb, it's going to be the pelvic girdle, which is going to include the pelvis, the femur, the patella, tibia, fibula, and then of course the tarsal bones of the ankle and the phalanges of the foot. So all of those are going to be the appendages or the appendicular skeleton. Now let's look at the classification of these bones. These bones are going to be either flat bones, and we see this in places like the sternum, long bones, which are going to be places like our humerus or our femur, desmoid bones, which are going to be things like our patella, which is our knee bone. We have short bones, which are going to be things like our carpal bones or our tarsal bones seen here inside of our ankle. And then we have irregular bones, and irregular bones, a good example of that would be our vertebrae. So those are the main categories that we can classify each of the bones, and that is based on their shape. So some more example of each of these classifications. If we're looking at long bones, obviously things like the femur is going to be a long bone in that their length is going to be much bigger than their actual width. So that's an easy one. Some other bones that would fall into this category would be parts of our the bones of, let's say, our foot. So we have our metatarsals and our phalanges that all fall in this category because they are longer than they are widthwise. Now, not to be confused with the tarsal bones here, which are going to be part of our short bones. So the long bones, even the foot bones or the hand bones falling into this, just not the wrist or the ankle bones. So all of those going to be long bones. If we look at our short bones, here we have these good examples here. And that is going to be our sesamoid bones, so things like the patella fall into a short bone category, although a sesamoid is just going to be sort of this special type of bone that is going to form with inside of tendons and don't actually articulate with another type of bone. So our patella, which is our knee, is in that category, as well as some small bones that we find on the bottom of our foot, and those are going to be sesamoid bones. And so some people have those bones as well. But short bones are going to be cube shaped. So things like our wrist, our carpal bones that we have, these are going to be sort of small, square, and cube shape. They're sort of irregular looking as far as shape goes, but they fall in the category of short, not irregular bone. So if we talk about irregular bones, the good example of that is going to be our vertebrae. So we already talked about that on the slide, but vertebrae irregular in shape in that they don't have a very long look, they're not flat, and they definitely aren't cuboid. So they fall into the category of irregular bone. The sphenoid and the ethmoid also fall into this category. And while this is an articulated skull and you can't see this, the sphenoid bone here is this butterfly-shaped bone that you see, and it's irregular shaped. And then the ethmoid bone also found up in there are some examples of the irregular bones. Now, some examples of flat bones. So flat bones, as we had already seen on the PowerPoint slide, we have things like our manubrium and sternum all falling into that category of flat bone. You can see how it's kind of like a plate. And speaking of that, if we look at the top of the cranium or the skull bones, and these are very flat in shape. So that's going to count. And I bring back up this part of the skull or the base of the skull, and these two are also flat bones. Again, not to be confused with things like the sphenoid bone that sit inside of the skull that are irregular in shape. When we get into the axial skeleton a little deeper in the next chapter, I will show you a disarticulated skull and you'll be able to see these individual pieces. So that's going to be the difference between flat and those irregular. So most of the skull bones fall into this category. The other flat bone we have is the hip bone. And you can see the sometimes called the coaxial bone. This is going to be just one side of it. This is going to be the left coaxial bone. But this is a flat bone as well. So we have the long, the flat, the short, and the irregular. So those are all the categories of bones that we have. This figure is just showing the head of the femur, and it's a good example of the two different marrow cavities that we have. What you'll notice right here in this central canal is going to be the yellow bone marrow. Remember, I already mentioned one of the features or one of the roles of bone is to be a storage place for our triglycerides, which are our fats, and that is inside of the yellow marrow. Now up here we have the red marrow, and that's important for hematopoiesis, that formation of the red blood cells. Let's look a little bit deeper at the different areas of the long bone. So here is the picture of a femur, and a few things that we can see is that we have spongy bone up here at the top, and we have compact bone going down the shaft of it. Let's talk about the main areas of the bone. At the ends of it, we have the epiphyseal regions or the epiphyseal end. We have them at either end. So this is the distal epiphysis down here, which will articulate with our lower leg, so parts of our tibia. And up here at the proximal end, this would be called the proximal epiphysis. The place where it meets the shaft or the diaphysis is called the metaphysis. So where they meet, the metaphysis, sort of sounds like meat. So epiphyseal ends, the metaphysis, and then the shaft of it is the diaphysis. Now, if we look at the cavities, like we saw in the last slide where we talked about the bone marrow, you see in the central canal, we have the yellow bone marrow, and then we have red bone marrow is going to be around that area. We would be able to see that. Now you notice up here in the epiphyseal end, we have spongy bone. And so at the ends of the bones, we have spongy bone. And we have compact bone around the circling sort of the shaft of the diaphysis. The space where the yellow bone marrow is located is called the medullary cavity. Some other things you see on this is the articulating cartilage. And you'll see this at both the proximal and the distal ends. And this is going to be a protection area of a bone. And articulation simply means where bones are rubbing together or where they're articulating. All right, this slide looking at the difference between the periosteum and the endosteum. The periosteum is going to be the outside surface of the bone, so what you are able to see on the outside of the bone. And if we were to cut it open and look on the inside, we see the endosteum. And that's what's going to line that medullary cavity that we saw back here. There's that medullary cavity. This is peeled back or cut open where you could see inside of it. So normally you would have the periosteum on the outside, and you wouldn't be able to see in here. You wouldn't see this medullary cavity where that yellow bone marrow exists. But on the inside lining of that cavity, so if you picture the inside of it, that's called the endosteum. Now, inside that inner lining are a lot of different cells that are going to be really important for us. And we'll talk about the roles of these cells here. We could see the endosteum here. You could see an osteoclast. You see osteoblasts here. You see bone matrix. We see an osteocyte. And we see osteogenic cells. But we'll talk about the importance of each of these cells. So let's look at the flat bone and the anatomy of a flat bone. And it actually is quite brilliant in how it's made, in that there is this what's called spongy bone in the middle of it. And it looks kind of like a sponge. And there's compact bone on either side, or it sandwiches the spongy or the diploe area of the bone. And what makes this so special is that it makes it really tough and very protective. And that's going to be important because we find this in places like the skull bone. Remember, where we looked at all the places we find flat bones, and the skull bones were one of them. And this pattern here, this spongy pattern, makes this very strong. Think of it like like a bridge, and the suspension wires going every which way. And that is going to add to the integrity of this overall bone, making it be able to withstand pretty hard blows without becoming broken or impacted, so that things like the brain that sits inside the skull are protected from hard blows. So here, this is talking about different features of the bone. So as we get into the next chapter, we are going to memorize all 206 bones. Don't worry, remember, we have a right and left for all of those appendicular bones and even some of the bones up inside of the skull. So you won't have to memorize 206 per se. But each bone is going to have specialized areas, and each of these areas serve a purpose and have some sort of role. And if we memorize these words for the features, there are a lot of things that are going to become easy to memorize, like the origin and insertion of muscles, or even the articulating points. So the head of a bone is kind of roundish, and we see that in a lot of different bones. Tuberosities are sort of outcroppings or bigger areas that come off of the bone, often serving for attachment points for muscles. A fossa would be an indent. A condyle is also another articulation point. A facet is going to be sort of a smooth indented area where it also sees articulation. Fossas are sort of these smooth areas. Crests are going to be like crests of a hill. We also see different openings here in this picture. So things like foramens are openings. Sinuses can be openings. Canals are openings for things like vasculature. Fissures also are going to provide openings for things like nerve supply and blood supply. So all of these are going to be opening. So these are some of the features that we see, and depending on where they are, what they look like, is sort of can predict their function. All right, so here are four main types of cells that we find inside. These cells are going to be osteocytes, and osteocytes themselves are responsible for keeping the maintenance of the bone. So the density of the bone, if you want to say, and it's going to pick up stresses that are placed on the bone and either stimulate osteoblastic activity or osteoclastic activity. The second one are these osteoblasts, and osteoblasts are going to form bone matrix. And I often think osteoblast, B for build, and osteoblasts are bone building cells, meaning they're going to lay down more bone tissue and make it stronger and more robust. On the opposite of that is osteoclast cells. And osteoclasts are important because it's going to stimulate bone reabsorption or the breakdown of bone. So these break down and osteoblasts build. Osteogenic cells are going to be stem cells. And these cells are really important here because these are the cells that are going to differentiate Or what that means is these cells can become what they need to. And in this case, they can either become osteoblasts, osteoclasts, they can become bone lining cells, or they can remain as osteogenic cells. So these are the four main types of cells that we find inside of the bone. All right, we've already looked at spongy bone before. We looked at this spongy bone that we find within the flat bones of our skull, and also we find them at the epiphyseal ends of our long bones. But along the outside of it, along the shaft of our diaphysis of the long bones, is compact bone. So this is sort of the thin areas that are going to surround places like the medullary cavity of our long bones. And so here is an up close diagram of it. Now you notice here is trabeculae, and this is part of the spongy bone. We find this on the inside lining of the medullary cavity. Now in this compact bone are these concentric lamellae, or these rings that we find. And the layout of these look much like the rings of a tree, which is what's going to help make this so strong for us. We have in the middle of that are going to be the central areas where we have nerve supply and blood supply. And you see them in these canals called part of the Aversion system, which is how we're going to get nutrients around our bone itself. On the outside layer, you see the periosteum and the osteogenic layer. Osteogenic layer just meaning how we're going to create new bone to become looking like this bone. And then the periosteum, which is the fibrous protective outer layer. So kind of the different areas we see of the compact bone. Here you're looking at an up close view of the trabeculae pattern we see inside the spongy bone. Notice that there still is going to be the lamellae, or the concentric rings, and the outside, or that end ostium on the outside of this trabeculae that makes up all this spongy bone. So while this is spongy, and we looked at the compact just a moment ago, what makes it spongy, if we look at it up close, is all of this hard bone material. So it's not that this spongy is not strong, because here you can see this trabeculae pattern, which actually does make it really strong, but you could see those concentric rings. We see the osteocytes and the osteoclasts and osteoblasts all there to help the maintenance of the overall bone health. First thing I want to talk about is something called Wolff's Law. And Wolff's Law simply is that when we place any stress or strain onto our bones is going to respond accordingly and become stronger. And it does this by the use of the osteoblasts and osteoclasts. Now remember, osteoblast, bone building, osteoclast is going to be the breakdown of bone. And this fine line between osteoclastic and osteoblastic activity is what's going to make bone stronger. So Wolff's Law, if we look at, for example, let's look at a femur. If we look at a femur, we notice all of these sort of outcroppings or anatomical landmarks on the bone. And all of these are created because there is something attaching to this bone, and it becomes big and has a nodule because of the stress and strain put on here. So imagine a muscle attaching to this point and a constant pull of that muscle as we function and move. The stress created on the bone from the pulling is Wolff's Law, or I guess how it responds to that stress is Wolff's Law, and states that we are going to build up that bone to help make it stronger because we are putting it under a lot of stress. So osteoclastic and osteoblastic activity start ramping up. So we are going to use osteoclastic activity, and bone reabsorption is going to occur. We're going to take that bone down and we're going to replace it with osteoblastic activity. And we're putting down more and more and more bone matrix to make it harden and make it be able to withstand the force. Well, putting down more osteoblastic activity, or having more osteoblastic activity, means that we're going to get more and more bone built up. So we start seeing these growths, or these kind of bigger regions of the bone, because more stress is being placed there. So we're having more osteoblastic activity, then we see osteoclastic activity. Now, sometimes the opposite can occur, and under certain diseases or lack of stress being put on bones, we see more osteoclastic activity than osteoblastic activity. For example, if we do not have enough um, calcium uptake, or we don't have enough stress being put on the bones to stimulate that osteoblastic activity, what can happen is that the bones become weakened or become osteoporotic. It increases the risk of fracture, especially in the hips, the spine, and the wrist. We often see osteoporosis developing over years, but we see it more commonly in older adults, particularly in women after menopause. And the reason why is women are getting it more often is because after menopause, we see a sudden dramatic drop in estrogen. When we have a drop in estrogen, this can create problems within bone because estrogen levels are going to help protect bones by balancing the process of that osteoblastic and osteoclastic activity. When it's decreased, bone reabsorption is going to speed up and bone laying down or that osteoblastic activity slows down. So reabsorption speeding up and the putting back of that bony material is slowing down, which means we get a loss of overall bone mass or density. And this makes the bones weakened or fragile, which puts us at risk when we fall. Now, women are not the only one who are susceptible to osteoporosis. Anything that encourages more bone reabsorption, that osteoclastic activity, and not enough osteoblastic activity or the laying down of the mineralization or the mineralization of bone, we start seeing this imbalance and osteoporosis can occur. So even in men, this can happen. Now, vitamin C and vitamin D are often going to be the screening we use before deciding whether or not someone is osteoporotic, which means we can also look at the bone density with imaging. But calcium and vitamin D play an important role in this, as well as weight-bearing exercises. So remember, I said that Wolff's Law is what happens when we put stress or strain onto our bones, particularly things like weight-bearing exercises. If we are putting stress and strain on the bone, Wolff's Law states that we put down more bone to help protect it or make it stronger. Hence, we get more osteoblastic activity. Calcium and vitamin D, calcium, if we have calcium present, and vitamin D, or some of the precursors of vitamin D that we have inside of the liver, this is going to help with that. So one of the things that we often prescribe for women who are osteoporotic or going through menopause is going to be about calcium and vitamin D. Vitamin D is just important because it helps with the absorption of calcium in the small intestine. So we often prescribe both. Now, weight-bearing exercise also prescribed. Side note, this is why when people come back from space, they often are very osteoporotic or their bones are very weakened. And that's because Wolff's Law is not taking place up there. There is no weight bearing happening on a bone. You can also see this in people who are wheelchair bound for years or have one limb that they don't use for some certain reason, an injury or a birth defect. And we notice that the mineralization or the density of a bone that is not being used compared to a bone that is being used, the density of that is significantly less. And that is because it isn't under the stress and strain and Wolff's Law isn't occurring. I hope that helped sort of explain osteoblast, osteoclastic activity, a little bit about osteoporosis, the importance of vitamin D and calcium. Side note, vitamin D, how we actually convert some of the precursors inside of our liver is from the UV rays from the sun. So also an important thing for us. So sun, vitamin D, calcium, all of it really important. This is all about ossification. Now we do ossification a few different ways inside of our bones, but this is endochondral ossification, and this is broken up into 5 different steps. Now, when we're in utero and we are first starting to develop right after implantation occurs and after the heart is made and all the vasculature, we start forming bones. And that bone starts out as cartilage, so it's very cartilaginous. And all of the mesenchymal cells, some of the cells that we are first born with, are going to differentiate. Again, that word just meaning that we have cells that are sort of stem cell in nature and they start differentiating or changing into the type of cells they're meant to be. And they are turning into chondrocytes. We notice that we start getting sort of this collar around the cartilage, and we start getting some calcification. We get a primary ossification center in the middle, and this is going to be important. This ossification center, the primary ossification center. And we get this bud starting to develop, and this bud has the beginnings of the vasculature. And you notice the vasculature getting bigger here. This is important because the way that we get calcium to areas and nutrients is going to be way of this vascularization that now is here. We start seeing a calcified area, an uncalcified area. So we're starting to see this area where calcification occurs. We get a secondary ossification center, and all of our bones, the bones that we look at, all are going to have primary and secondary ossification centers at different developmental landmarks. And so this doesn't happen all at once, nor does every bone go on the same schedule. So some bones aren't fully calcified until later on in life, or as we get towards adulthood. The kind of interesting fact about the primary and secondary ossification centers. The cartilage remains at the growth plate, particularly in long bones. So if we think about a juvenile growing up, so a small kid, we have the primary ossification center and the secondary ossification center. And the place in between is going to be what we call the growth plate. And this growth plate is at it's sometimes called the epiphyseal plate. And so this is where growth is happening. And this growth is important because these cells here have not hardened or calcified. And it's going to grow in sort of elongation patterns, giving us longer bones, essentially making us taller. So all that growth is happening here at the epiphyseal plate. In fact, if this epiphyseal plate closes too early or we get fractures at this epiphyseal plate, we often can see problems with overall growth. And so sometimes one leg can be longer than the other if we get damage at this spot where new bone is being laid down and where it later turns into calcified bone. This is that longitudinal growth that's happening there at that growth plate. So at that epiphyseal plate, right where the epiphysis meets the diaphysis. Remember, epiphyseal ends and the diaphysis is the shaft of the bone. But at that plate where it meets, this is the growth that's happening, right? So you can see the growth plate. We see matrix production here, and we see the blood supply getting everything we need. Proliferation zone, we're creating more and more cells. So this is where mitosis is occurring. And this is where maturation is going to happen, and we're accumulating things like glycogen and lipids and phosphatases in this area, and we're starting to get calcification. So as we get calcified matrix, there's going to be some cell death, and then we get ossification. And this is going to be important because this is what's giving us the length of bone. So as this all pushed down, so we get hardened material, and the overall length of the bone is going to increase. Now, this all keeps happening until that epiphyseal plate closes, and we no longer have tissues that are replicating. We're not creating or proliferating new tissues, and it all becomes calcified and closes. This slide just looking at the different types of fractures that we have. Now, we classify fractures on a few different items. One is whether it's open or closed. From there, it can be comminuted or not, meaning it's aligned or it isn't. And then open and closed just means whether or not the skin is opened or closed. And then, of course, whether or not we have multiple areas or not. So here's comminuted, which means we have multiple fractures going on. So more than just one. We can have impact type fractures where we sort of have like a compression fracture of a long bone. Now we can have compression fractures of things like our spine as well. Green stick fracture, this is named because if we were to bend this bone here, much like if we picture a very green stick or branch compared to a very dry branch like we have here in the desert, if we break a dry branch in half or try to bend it, it just snaps. If we break a green stick, we start to see it bending or starting to fracture, splinter on the side that the bend is occurring, so the greater bend. So if we were to bend this medially, we would see the fracture or a green stick fracture here. Oblique fracture just means it goes in an oblique line. Spiral fracture, transverse fracture going across, open meaning has an open wound and penetrating the skin. Closed means it has not penetrated the skin. So these are just different ways that we can classify and talk about a fracture. Now, talking about fracture, let's talk about the stages of repair or healing. So the first thing is that we get a hematoma. And hematomas, while they're a nuisance and then cause extra pain because we get swelling and a lot of blood and we get bruising that we see, a hematoma is meaning that we are getting a full flush of the cells we need to help bring in repair. And we're also going to get rid of damaged things by this hematoma. So this is important because it's the first stage of healing. After that, we get this sort of callus formation or this color built up. Then we start getting callus of spongy bone where we get this kind of new bone laid down, connecting the pieces. And then we get a healed fracture. And this is where remodeling is occurring, where we often get that overaction of the osteoblast, trying to lay down new bone. I mentioned vitamin D already. The vitamin D, while we ingest it, or we can get it from sunlight as through the absorption of our skin inside of the liver. It's going to be important that we have this because it's going to breathe the precursor parts of vitamin D inside the kidneys. Vitamin D can be then transformed into an active form of vitamin D. And that is going to be important because it can help with the absorption inside of the small intestine of calcium, which remember, calcium important for overall bone health. So if we look at the density of bones, we see that the highest peak of density for both males and females happens around the age somewhere between 20 and 30. And after 30, 40, we have this plateau. And after that, we start decreasing our bone density with age due to just age in general. And you see a significant loss in women during menopause. So this is kind of the peak. We have bone growth from when we are first born, that peak in our 20s, we have that plateau. And after 40, it is all downhill and we start losing bone density. And we've already talked about how we can help prevent that, and that is going to be with weight-bearing exercises. So it becomes even more important as we age to be exercising. This slide just talks about the different pathways that we can maintain our calcium levels or keep it at homeostasis. And so homeostasis is this 10 milligrams per deciliter if we're looking at blood level calcium. This is going to be homeostasis. We have our thyroid gland that's going to be important and our parathyroid gland. So our thyroid gland is going to release calcitonin, a hormone that is going to inhibit osteoclastic activity. And that means that we are going to reabsorb calcium in the kidneys, and that is going to decrease blood level calcium. So if we have too much blood level calcium, this is how we decrease it. If we have too little, parathyroid hormone is going to be released from the parathyroid gland. That is going to stimulate osteoclastic activity inside the bone, which is going to release calcium into the blood, which we need because remember, we just had a loss of calcium. Calcium also is reabsorbed from the urine where we might have been urinating it out or going to be urinating it out, and we reabsorb it in the kidneys, and also calcium absorption in the small intestine, and that is, remember, needing vitamin D synthesis to occur so we can uptake it, and we get an increase of blood calcium levels. So this is all about just maintaining blood calcium levels at any given time, where we have the thyroid and the parathyroid gland sort of helping stimulate and keeping that homeostasis. All right, I know that was a lot of information. We talked about the different types of bones that we have, the different classifications of bones. We talked about the different structures or anatomy we might see within bones. And we also talked about growth and the cells of the bone and overall repair of the bone. I hope that that chapter helped you. We are going to move on now into the skeleton itself. So we'll talk about the axial skeleton and the appendicular skeleton next.